Welcome to your Meditech PCS overview training video. This video will show you how to navigate the initial menu options in order to reach a required status board and explain the layout. From the initial menu, click PCS Status Board. From the next menu, select any location and choose the appropriate area. For the purposes of this video, a training area will be used. You are now viewing the status board, which contains a number of columns designed to give an at-a-glance view of the patient's record. The order of the columns can be adjusted by clicking on one of the headings in the top row of the status board. The first column on the left-hand side is used to access the patient's record, or work list, as it is referred to in Meditech. The open chart icon at the top of the column signifies this. Click in the column next to the patient's name when you want to open the record. The next column contains the patient's demographics. SI stands for Special Indicators, which are a series of different alerts relating to an important aspect of a patient's care. For example, a safeguarding issue or known dementia diagnosis. Special indicators will show as either a red, yellow, or green flag, with the highest priority flag being displayed. The next column displays the consultant responsible for the patient's care, location of the patient on the ward, and length of stay, or LOS. The EWS, or Early Warning Score column, displays the score achieved by the patient's observations, irrespective of the scoring system used. The GCS column displays the Glasgow Coma Scale of the patient if they have had those observations taken. The VS or Vital Signs column contains an icon which, when clicked, will take you through to view the patient's vital signs. The Last Observation or Last Obs column reveals the date and time the last set of observations were taken, the observation's frequency, and the scoring tool in use. The At-Risk column will say yes if the patient meets any of the patient at risk criteria. The next OB and fluid balance column displays the schedules assigned to these assessments, and timings will turn red if they are overdue. The sepsis column refers to patients at risk of sepsis, and the answer pulls in from the observations chart. The MAR or Medication Administration Record column contains an icon, which, when clicked, will take you straight to the patient's electronic drug card. The next 5 columns are populated from the nursing handover. Once completed, the information will be displayed on this part of the status board. The Other Comments/Actions column is for information purposes only and does not form part of the patient's record. The Orders and Allergies column will display the information entered into these parts of the patient record. This will be covered in another training video. And that's it. If you need any further guidance, please contact a member of the IT System Training team. Details are on screen now. Thank you.